So good morning to you all. I see this has been a very long program, but a very nice and fun program. I don't want to be very, or at least boring for you, but it's just to give you an idea of the structure of the Horizon Europe. So I'm a national contact point for Portugal for the health area, the health cluster. I'm national contact point along with my two colleagues, Anabela and Afonso. We are the Portuguese NCPs, national contact points, but you're coming from a lot of countries and you're probably having your NCP at your country. Usually there's more or less a rule that we should only provide services to the community of each of the country that we belong to. So in case you don't know your NCP, one of the ways you do that would be just to Google on the internet NCP and Horizon Europe, and you will end up with this webpage that you have here on your right, where you can select the country where you're coming from, and the function here is health, but you have many other areas, and it will give you the name and the contacts of the person in your country that you should contact to. And why should you contact the NCP from your country? Is because one of the functions that we do, it's besides promoting the calls and what's available in terms of funding for, in this case, the health cluster of the Horizon Europe, we also try to advise you if your ideas are fitting in the calls that are open, or if there's other chances that you should look for your ideas. When you're really working on a proposal and you have to build your consortium, we can also try to give you some tips and also help you with searching or finding a partner in another country that might have the skills that or to develop the activities that you really need for your specific proposal. Also in writing, and this is not for all the NCPs, I have to say, in Portugal we do, but not all the NCPs do. We read the proposals from the coordinators, only from the coordinators, and we give some tips and advice that you may take or not, but so you can improve your proposal before the submission. Even after the submission, if you are granted, which is something that we hope you are, we continue helping with any questions that you may have, and we have some special contacts with the European Commission, so we can try to have answers faster for you if we don't know the answer. But besides being a national contact point, we are also the delegates for the cluster health. This means, and this is something that in some other countries, it's not exactly the same person that do these two functions. But as delegates, we try to transmit to the Commission which are the priorities for the country that are, we do like a survey, we contact the community and see which are the priorities for health, and we try to transmit those to the Commission so they can build the work programs where you have the calls. This is something that if it's done just by one country, usually doesn't work very much. Sorry, but for instance, here you have a lot of countries present. And if you're really interested that an area should open in a work program for health, one of the things that you can do is, first of all, find the justification for that call. It couldn't have been found before. And after you have that justification, you send for some of the people here that they should contact their delegates. And if several delegates go to the Commission and say, we're very interested in this, then you have a different weight, and the Commission might, it's not in the future program. So now really entering in the Horizon Europe. So Horizon Europe, it's a European research program. There are several other programs from the European Commission, the health program, the Euratom program for atomic energy, for agriculture. This is the research. And in research, there are several areas in research. It lasts 7 years. It started in 2021, and it will last until 2027. It has a structure that it's not very different from what was the previous structure in Horizon 2020, sorry. It has 3 big pillars and 1 transversal area. It's $95 billion euros for the 7 years. And in the pillar 1, I'm going to briefly explain this. In the pillar 1, it's the pillar of the fundamental research. It's the excellence pillar, where you have the European Research Council, the ERC grants that probably most of you have heard about. You have also the Marie Curie actions and the infrastructures. So here, and the slides are going to be given to you after. Here you have all the grants from ERC that you can apply to. It depends on the age or the number of years after you had finished your PhD, also how your research is going. And in terms of the Marie Curie actions, it's more for networking, capacitation. Usually there's NCPs for these areas in each country. So for instance, here in Portugal, I'm not the one that is in charge of this part, but just to present you these areas. So I'm going to skip pillar 2 now. Pillar 3, it's the innovative pillar. It's more dedicated to innovation. It has, as a new area that it was not present in H2020, it's the European Innovation Council. It's something similar to the European Research Council, but for the innovation. It's not only for companies, but it's very much for companies. But the researchers and universities can also enter, especially in the Pathfinder, which is in the first levels of the TRL. You also have some grants in the other TRLs, and it's something that you can keep in mind because it has a lot of money too. Then we have this transversal area where the costs are. This is the widening area, and the widening means that there's a list of widening countries, which are the countries that are not so developed in terms of research. It doesn't mean in economical terms, it's research. And what the Commission found was that there was, most of the times, the grants were going for the same countries, from the same entities of the same countries. So this area here, it's not to do research, but it's to capacitate the countries that are less developed in terms of research, so they can compete at the same level with the entities of those more developed countries in terms of research. So Portugal, for instance, is here, and so we can benefit from some of the grants here, and probably some of your countries are here too. The cost, for instance, you have to have a minimum of, I don't know exactly the number of countries, belonging from these widening countries to have a cost. And then we have pillar 2. Pillar 2, it's where the cluster of health is. It's divided in 6 clusters. It's a thematic and a strategic pillar. Here, unlike the pillar 1 and pillar 3, here it's not a bottom-up approach. It's not, the research is not from what the researcher wants to do, but what the Commission wants you to do. So here we have work programs where the Commission made first gap analysis, an analysis of what is missing, which research should be funded, what are the main problems in terms of each of these 6 areas, and those are the areas that will be funded in the work programs. To do this analysis, one of the things that we have to take in consideration are other policies that are present, and that so we don't have any overlap also with other calls from other programs. So here are some of the policies that should have been that have to be taken in consideration. For instance, you have the Europe Splitting Cancer Plan, which is something very dedicated to cancer, the health program from WHO, the Green Deal, the Conquering Cancer also, and the digital program. So these are programs that have to be taken in consideration when we're defining the calls that are going to be present in the work program. And other issues that have to be taken in consideration when defining that program, it's the sustainable development goals, the European Commission priorities, and the key strategic orientations to go into the impact areas. Then we have the destinations, and this is called destinations, I will further tell you, because it's where we want to go, where we want to achieve. It's the impact, the expected impacts that we want to achieve with the results from your projects. And then we have the expected outcomes that are present in each of the topic. In terms of topic, I mean a call. And all your proposals will have to answer at least to these two last levels. The expected outcomes that are in that call and the expected impacts that are at the level of the destination where that call is. I will explain that a little bit further. So first, when the work program is defined, we have to take in consideration all these Commission priorities to have a stronger Europe in the world, a European Green Deal, response and recovery from the COVID-19, and an economy that works for the people. There's 4 strategic orientations, but in health, we just have to take these 2 in consideration when writing the program. And then we have the impact areas. There's these 4 impact areas: high quality digital services for all. This is, why am I telling you this? Is because when you're writing your proposal, this is something that you should have in mind to make the framework of the proposal. You cannot, since all these proposals under the cluster health and all that are under the clusters in the pillar 2, they have to answer to all the criteria and the definitions that are behind. So you should know them before. So the other impact areas that I was telling you about is good health and high quality accessible healthcare, resilience, European Union prepared for emerging threats. Sorry. So now we hit to the destinations. In the cluster health, we have 6 destinations, and I will explain that or talk about each one of them later. But these destinations, as I was saying, are where we want to go to and where you have the impact, the expected impact that you have to answer to. Your results are going to answer to these expected impacts in the destinations. How is the work program then designed, really? You will have the destinations where you have the expected impacts present. You will read them. Then you have, in each one of the destinations, you have the calls where you have the topics, and it will inform you about the year where that topic is going to open, the type of action that I'm going to talk to you about, the expected outcomes of that topic, meaning what your results are going to answer to, and the scope. It means the area that we're talking about and the problems that are behind. So they are funding this call. In terms of type of actions, there's 3 main type of actions present in the work programs. There's more, but these are the main ones. It's a research and innovation action. This is an action mainly dedicated to research. It's funded at 100% to all entities. Then we have the innovation action, which has a bigger percentage of innovation activities, for instance, pilots, trainings, any other thing that might be more for innovation. And here the funding, it's 70%, except for those non-profit entities that can still receive the 100%. And then we have the coordination and support actions that are also funded at 100%. This is not exactly a research. This coordination and support actions that we usually say CSAs are more to study areas that can be funded in the next work program, or for instance, to prepare a partnership that I will talk to you about. It's not really to do research, it's more gap analysis and that kind of activities. So all the projects or proposals that are submitted under the Pillar 2 have to be collaborative projects. There's a minimum, you have to have a consortium, and there's a minimum of 3 entities from 3 different member states or associated countries. One at least has to be from a member state. And then the rest of the consortium, it has to make sense for the proposal that you're presenting. There's no rule about should it have an university, should it have a hospital or SME. It's only, you should put all the entities that make sense for the activities that are in your proposal. So if it doesn't make sense, don't put it. The Commission is very, very reasonable in terms of that. So in cluster health, just in cluster health, we have 8.25 billion euros, and this is divided in 3 main funding modalities. The first one is the work program. It's what I was talking about. Then we have 2 other modalities. One is the health partnerships, and the other is the mission on cancer. I will talk a little bit about them. Just for you to know that when we're talking about the cluster health, if we're just looking for the work program, we might be missing a lot of money that comes from other areas. So going through the work program, and now I will explain the destinations. So the work program, it's divided in 6 big chapters, if you want, are these destinations. And it's under each of one of these destinations, sorry, that you'll have the calls. So the first destination, it's staying healthy in a rapid changing society. It's more focused on the individual in a focused in health promotion, disease prevention. The second destination, it's more on what surrounds the person. So it's more on the health determinants, the environmental determinants, social determinants, occupational determinants, etc., that can change the way that the person can become ill. The third destination, it's dedicated to the diseases here. So here the main goal is to reduce the disease burden, and this is the destination that has more money. The fourth destination is more for the health systems, to turn the health systems more resilient, more answering to what are the needs of the Europeans nowadays. The fifth destination, I think it's something that might be very interesting for you. It's the development of new tools, new technologies, new digital instruments, whatever. And it doesn't really say about the disease. Usually it's the development of that tool that you can use in whatever disease you want to. And the sixth destination is about the health-related industry. It's to promote the health-related industry in Europe and in the world. The calls from 2023 just ended now in April. So we're now just having the 24. There will be 15 topics open. I will show them to you, but briefly, because otherwise you will fall asleep. These 15 topics are divided in 6 are single stage calls, meaning that you submit one proposal and that's the evaluation, and 2-stage calls where you have the first proposal, which is a 10-page proposal, much easier. And then those that pass for the second stage, then they have to submit the whole proposal, which is 45 pages. It decreased from the H 2020 now to the Horizon Europe. It was 70 and now it's 45. You have to be much more concise, much more objective. It's more difficult, but it's doable. So, as I was saying, I'm not going to tell you about all these topics, those 15 topics, but here in this first destination, you will have 2 topics that are more for prevention. One is for the prevention of children and adolescents regarding the digital society nowadays, and the other one is for personalized prevention in non-communicable diseases. Then we have destination 2, where they want to study the role of environmental pollution in non-communicable diseases. Destination 3, as I said before, it's the one that has more money. And here you have also a co-fund which has 100 euros, but here you have a lot of proposals or topics that are more dedicated to pandemic preparedness. There's, for instance, one that has to do with brain disorders, validation of fluid-derived biomarkers for the prediction and prevention of brain disorders. And I'm not going to read them to you, but it's something, some of them are research and innovation actions. It's one thing that you have here in one of the columns, and there's one CSA still. Destination 4, as I was saying, it's more for the healthcare systems. And here it's a call to improve the access of vulnerable people to the healthcare services. And in destination 5, the one that I was talking about, tools, the 2 topics, one is about non-animal human-based tools, and the other about bioprinting of living cells for regenerative medicine. And the last destination, it's more about one, it's about methodological frameworks for clinical evaluation, and the other one, it's about the new approach methodologies and about regulatory issues that they want to understand better this. So then we have, as I was telling, the work program, the cancer mission, and the partnerships. I will talk briefly about the cancer mission. The work program that we had for the cancer mission ended, what did I do? Ended in 2023, no? Yeah, I think so. And actually the missions, there's 5 missions. One is in health, it's the cancer mission. They are all coming from the Pillar 2, and they have a special work program just for them. What is different in the missions than we have in the work programs? The missions want to be much more bold and bigger, and so it's something that it's not just research. You can have, for instance, change in legislation just to reach the goals of each of the missions. The goal of the mission cancer is to improve the life of more than 3 million people by 2030. And there's 4 areas where this missions is going, or the mission cancer is going to act. It's in prevention, diagnosis and treatment, in quality of life, and of course, know more about cancer. So it's the understanding area. This is done, and as I was saying in the beginning, there's other policies behind. And this is done in close collaboration with the Europe Spitting Cancer Plan, which is one of the missions from the European Commission. I don't have, just, so the missions now, there's no calls. The 2023, they ended, and the missions are being evaluated to know if they are going to continue or not. So in principle, yes. And if yes, then we probably are going to have a new program with calls for cancer by the end of August, beginning of September. It's something that we don't know. It's still to know. Then we have the partnerships. And the partnerships, we can have three types of partnerships: institutionalized partnerships, which are really entities, independent entities, and they manage their own money. The co-funded partnerships that manage money from the Commission and also from the member states, and the co-program partnerships that we have there one, but we're not sure it's going to be a co-program partnership or a co-funded partnership. The partnerships, usually they have a strategic research and innovation agenda behind. So they have their own calls, but they have an objective behind. They coordinate the calls, so you can go, it's not calls randomly funded as we do in the program of the cluster health. Here you have a rationale behind that strategic agenda, and the calls are going to be funded for a reason. So here, for instance, we have the rare diseases partnership, the personalized medicine partnership, the transforming health and care systems partnership, the One Health partnership. So these are partnerships that are going to be funded also by your countries. And when you're applying, this is a little bit like the ERANETs. I don't know if you were aware of the ERANETs, but when you're applying, you have to follow the rules of your country also. Sometimes it's not very good. And now we are going to have open 2 calls from the Innovative Health Initiative. It's one of the institutionalized partnerships. Actually, we don't know exactly yet when they are going to open. They are already published, and you can go to the internet site. Actually, in this slide, there's the link, so you can just go here. And you will see what they are going to fund in these calls, but there's still no date available. The Global Health Partnership. This partnership, it's mostly for the development also of clinical research on the sub-Saharan countries from Africa. So we have 7 calls, and there's 1-stage and 2-stage calls. Some of them are going to end now. It's the 1-stage calls. They are going to end now, and in June. And you can also click here, and you have the topics available. And now we have open one from another partnership, the Transforming Health and Care Partnership. There's the call Healthcare for the Future, that it has now open, or a deadline to submit an intent to make an application until the 23rd of May. Here, what they want is not really research in terms of laboratory research, but in this healthcare of the future, it's more a difference in processes, organizational procedures to change how the healthcare is going to be working in the future. Here is just a brief resume about the calls, all the calls that are available now, and just 4 other European programs that I think that might be very interesting for you. The U for Health program, which is the program for health, really. So the European research, the Horizon Europe is from the European Research DG. This is from the health research, the health DG. So the other is more for research, and this one is more for really assistential health. It's different. They are coordinated together. It's the first time that they are being coordinated, which is good. You have also the Digital Euro program, which might be very interesting. It has some calls also for health. The Euratom and the Erasmus Plus, which is more for capacitation of the people and higher education courses. So, and then I'll leave here our contacts, everything that you might want, even for making a contact with your NCP if you need and you cannot succeed in that, just let us know. We try to do that. Thank you.